Dietary trends and chronic disease in the United States. Food intake trends over time have shown variable patterns. In the United States, from about 1909 forward, the most consumed macronutrient has been carbohydrates. From 1970 to 2010, caloric intake for flour and cereal products has steadily increased, along with added fats, oils, and dairy fats. Overall, Americans have consumed more fats from 1909 to 2009. Monounsaturated fats have been the leader among fat consumption. Polyunsaturated fats come in next, while saturated fats remain somewhat steady and then was a bit sporadic as far as trends go. From 1909 to 2009, strike that, from 1909 to 1999, shortening, margarine, and other plant-based saturated fats increased. Then in 2009, consumption sharply dropped off. Regarding meat and seafood trends, red meat consumption in the United States between 1909 and 2009 was the most consumed meat. However, around 1949, trends show that chicken started to be consumed more among the American population. Americans began consuming more sweeteners in the late 80s, with corn sweeteners sharply increasing among the population. Coffee consumption rose in the 40s and began to drop again in the 60s, while alcohol consumption has steadily increased since 1934. By the mid-20th century, all major vitamins had been discovered, isolated, and synthesized. Nutritional deficiencies such as scurvy, beriberi, pellagra, pernicious anemia, and rickets had a cure. Single nutrient deficiencies led to the development of supplements and foods being fortified with micronutrients, such as calcium and phosphorus, iron, and specific vitamins. At the National Nutrition Conference on Defense, RDAs were announced for the first time in 1941 to provide guidelines for total calories and various macro and micronutrients. The first half of the 20th century saw recommendations related to prevent nutrient deficiencies. As time went on, public guidelines shifted to focus on the prevention of chronic disease due to dietary excess and poor nutrition choices. Excessive consumption of too many calories and poor nutrition choices, such as highly processed foods, plus a lack of healthy foods such as fruits, vegetables, nuts, seeds, and legumes, has led to an increase in chronic disease. In the United States, chronic diseases such as diabetes, heart disease, and cancer are the leading causes of death and disability. These diseases also are the basis of the nation's related healthcare costs at $4.5 trillion annually. Poor nutrition is a major risk factor for heart disease, type 2 diabetes, stroke, cancer, and depression. 6 out of 10 Americans have reported having a minimum of one chronic disease, and 4 out of 10 Americans have reported having at least 2 chronic diseases. The first half of the 20th century saw messages of increased nutrient intake to prevent and reverse nutritionally related diseases. In the second half of the 20th century, public guidelines shifted to focus on the prevention of chronic disease due to dietary excess and poor nutrition choices. Chronic health diseases such as cancer, heart disease, type 2 diabetes, and depression affect Americans and are a burden on the healthcare system. We need to ask ourselves, what more can we do to reduce the risk of chronic disease?